Ranking Member Levin for his opening statement.
Thank you, Mr. Chairman, and colleagues and Marilyn Tavenner, a warm welcome. We start this hearing facing a basic reality. Democrats want to make the Affordable Care Act work. Congressional Republicans don't. That reality has been reflected in 40-plus efforts by Republicans to repeal, dismantle, or defund the Affordable Care Act. That reality was reflected in their zeal, shutting the government and jeopardizing the full faith and credit of our nation, damaging our nation's global standing, and leading to enduring harm, costing our economy $24 billion, tens of thousands of jobs, a dramatic drop in consumer confidence. Now, having still failed to derail the ACA, the Republican focus of attack has shifted. The new front relates to healthcare.gov. There very clearly are challenges to implementing new pioneering access to health care. Consider these headlines. You can see them there. For example, problems plague rollout, NPR reported. Plagued by delays and confusion over coverage, said the San Francisco Chronicle. These headlines are from 2005, as Medicare Part D was launched. That year, in dramatic contrast to the Republican conduct to date, Democrats who had opposed that law worked to make it a success, working with Republicans on a bipartisan basis, Republicans who had passed that law to address many problems, and most importantly, we worked with our constituents to ensure they could sign up. The reality is that the Affordable Care Act, which Republicans are failing to work on with Democrats, is working quite effectively in states running the marketplaces. You can see from that slide. In Kentucky, more than 26,000 people have enrolled for coverage. In New York, more than 37,000 signed up. And in Washington State, more than 35,000 people had enrolled as of a week ago. And the irony is that Republicans have erected hurdles to states throughout the nation taking responsibility for implementing the law. The website for the federal insurance marketplace must be fixed, and it is being fixed. This gentleman from Salt Lake City, Mr. Sherburne, is among those who have enrolled. A self-employed father of 3, he has been uninsured for years, paying cash for doctor visits and the occasional trip to the emergency room, he told his local newspaper. Once he got into the marketplace website, he compared 38 plans and got coverage for his family for $123 a month. And I quote, "Once they get the bugs worked out, it will work well and bring peace of mind to a lot of people," end of quotes. And he added, "I'm thrilled to have coverage, period." Prior to this year, what awaited Mr. Sherburne and tens of millions of other Americans who don't get health insurance through the employer, but rather had to sign up on their own, was a maze of invasive personal medical history questions within applications that seemed to never end. When individuals did get through the process, too often a pre-existing condition, no matter how minor, was used to deny coverage, to charge exorbitantly high premiums, or to exclude needed benefits. Thankfully, these days are behind us. They are behind us. This hearing provides a chance for every member of this committee to proceed in a constructive, not a destructive manner. and for the administrator to lay out how the website is being fixed as it must be, and for everyone on this committee to join in this effort to make available, not to prevent access to, quality, affordable coverage for every American. I yield back.